protein may be low secondary to his kidney disease because he has some protein in his urine.
Okay.
Because he's already eating, they may have started to drop with his fluids. If he's eating even though they remain high, it's more of a sign that this has been going on for a while. The other abnormality on his urine is that he has increased epithelial cells in his urine, which are the cells that normally line the urinary tract. But when you see a lot of them, that can be a sign of cancer. So I was going to have, with your permission, the pathologist look at the cells to see if they look cancerous. Yep.
Please.
Yep. And that result takes 1 to 2 business days.
Okay.
So there's a chance we won't have it till
Monday,
Tuesday.
Tuesday.
Otherwise, he's definitely feeling better. When the times we see the tremors are mostly when he's sleeping, when he's up and active, which he is more often now because he's feeling better. We don't see them as much. And it is possible for high kidney values to cause muscle tremors. The term myoclonus will be used sometimes, but it isn't something we commonly see in dogs with increased kidney values, so I can't guarantee that the muscle tremors are due to that, but it's possible. And then the other thing that is a possible cause of his muscle tremors would be is if he had distemper at some point, that can do it. I know he was recently vaccinated for it, but the test that we can swab their eyes and urine for, we can look for signs of active infection.
Okay. I heard he had a lot of sores when you gave him a bath. He had some sores.
Yeah. So he was feeling good enough today and he's been very sweet, and he wants to be close to you, leans on you, that I thought it would be okay to give him a bath and it wouldn't cause him stress because I wanted to start to get him cleaned up.
Look how white he is.
Yeah.
It's so.
And so, and he's got shallow crusting and abrasions on his skin, and then he has a couple of bigger lacerations. I can put my clothes on
his leg. Can I just take the cone off while I'm here?
Oh, of course. Yeah. Okay. It's just because he was licking.
Yeah, I gotcha. We'll watch him just while we're here.
He's feeling a little better now, so he's starting to do more. He can absolutely have them. Hey, baby. Yeah, show them your name.
Hi, Nest.
Hi. I know, you just had a big reaction.
He smells so good. He does. He smells so good.
I think they like being clean.
He likes being clean. I see the tail.
His tail, that was a little crusted before, and in the bath you could see that irritation there. And he has this wound on this paw, which has been draining a little bit, so we're going to let that keep draining.
I saw that in the car.
In there clears out. And then the one, it's a little hard to see right back here. Oh, yeah. It's right here. Sorry. He's in the shadows.
Leg,
he doesn't feel like I'm not going to pull it out for him. And the inside of this hock joint is a little bit more thickened than the other one. And this leg, he does, now that he's walking more, he has a kind of mild to moderate lameness on, but it seems to be due to discomfort in that area. And he has a very mild lameness on this one. Then he had a bigger laceration that we just cleaned up, and just with local anesthetic. Dr. Woolery removed the necrotic tissue and got that closed up because that one he was bothering him. He wanted to lick it and clean it.
Oh, baby. Oh, my boy.
And he's continuing on his IV fluids and antibiotics.
Awesome.
And then he's getting a dewormer, even if his fecal's negative. We can still
absolutely.
have worms. And with
100%.
this exposure risk, we're not missing that.
No.
So, and when we saw his kidney values were higher, we did increase his fluid rate. He had a mild anemia, so a mildly decreased red blood cell level, but that may drop more the more time he's on a higher fluid rate for his kidneys because it can dilute them out. But in the meantime, he's definitely more comfortable and feeling a little better.
Big difference from yesterday.
Yeah.
I love that lip, Master.
Yeah. He's really he wants to be close to you.
Yeah. He loves to lean into you.
Yeah, he likes to lean in and his head or his hand.
It's so insane.
And he's very
very trusting.
An ophthalmologist would have to do the full assessment. I'm not getting any visual responses from him on exam. But he's very trusting and gentle, especially for not being able to see.
Right.
I love you. I thought of you all night long. All night I couldn't sleep. I want to curl up with you and sleep with you. Especially even since you smell better this morning.
Yeah.
Look at that little lip. Look at that little lip. It's so crazy when I was looking back at the pictures that Zoe took from the car and the transport. And I had him in my hands, and there's one picture where I know he's blind, but it's like he looked straight into my eyes and my soul. You know, it was
he
crazy.
knows you're there, and
he's very sensitive to your voice.
Yeah.
Do you have cotton in his ears right now?
Yeah, it's not in here anymore. This morning, and he's been okay without it.
Good.
It's obviously peaceful
Quiet.
now too, and his ears just had a little discharge we cleaned, but it wasn't anything bad.
So he has a lot of abnormalities to his blood work, which could be an indication of cancer.
Yes, one of the abnormalities that was in his urine could be related to cancer, and the blood work abnormalities could be related to cancer. His kidney values were very elevated, and that could be related to cancer if we do find definitive proof of cancer in his urine. Otherwise, either chronic kidney disease or an active infection, bacterial infection, or that can travel up the urinary tract, or potentially, if he comes back negative for cancer, we can consider other infections like leptospirosis, which he's already on antibiotics that cover for these things.
Okay. So we just have to wait for the results of the blood work, which should be back maybe Tuesday.
Yep.
2 business days, and of course it's the weekend. So all I can tell you is that while he's here with us, he's safe. Thank you so very much, Dr. Trout.
I'll let you guys
Watch
enjoy
your
him.
back.
Oh, that's all right.
Thank you so much. That is Dr. Trout. She's amazing. We're here at Blue Pearl, which is where we brought him yesterday. And we're just waiting on the results of the blood work. It could be cancer, it could be kidneys. We don't know until we get the results back. But what I can tell you right now is they have cleaned up all his wounds. They have given him a bath. Are you blinking? Are you blinking at all the noise?
He's so much calmer when you're
I'm going to give you, and if you can just focus the camera on me and him, mostly him. And then my little man.
$1 gram,
Nestor.
TID, and you can fill
Nestor. No, we don't even know if that's his real name.
Right.
Okay. Come here, sweetheart. I know. Oh, I want that thing. Oh, no, you can't go see these right now. You know why?
Oh, look at that.
Come on. Please. Eat it for me. So good. You want more? Here, give little pieces. Okay. Is that delicious? Is that delicious chicken? I warmed it up and everything.
You cooked?
I cooked. I hate chicken. I hate meat. But
This means a lot,
for
Nestor. You know,
I do
you're a
this.
special
I do
boy.
it for my dog, so. It's just boiled chicken, nothing on it.
Oh, look at him. He is perked up now. He is so happy.
Is that good? Yummy. I don't have to cut into little pieces.
Look at him go.
Is it yum? I wonder if he pooped yet. I know he peed. They walked him outside. He peed. Is that delicious, Misters? Yummy. You want some more? Can I have a kiss? Can I have a kiss? Come here. We got more. So gentle. Beyond.
And now that he's got the taste of the chicken, he's like wanting more, which is great. I'm glad he's got an appetite.
Me too.
It's fantastic.
This is so good. It's delicious.
He is very handsome. Look how... You go, Nestor.
Boxer in him for sure.
Yeah.
I see a lot of boxer.
Mm-hmm.
You just tell me when you're done, okay, Nestor? You let me know when it's enough. A little more? So you want to wait till later? Okay, we finish.
Can always get more. Unlimited supply of chicken.
Whatever you want, you get. Whatever you want.
This poor boy, look at, you can see
He's
just
amazing.
every rib.
He's all bones.
Yeah.
You
You
done?
can see his spine.
Yeah, okay, we take a break. Okay, that's a lot
Was
of
that
chicken.
good, buddy?
Good chicken. A lot of chicken.
He does. He loves the chicken. Got a pillow?
I can get you more pillows. You're just so handsome. You're the handsomest boy I've
He's
seen.
so happy.
You smell so delicious too. You got a sticky nose. Oh, mushes. Mushy fish. Mushy, 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 mushy. Mushy. I love sweetness. We're gonna get you everything you need, whatever you need, okay? Yeah, we're gonna make you feel better. Yeah, you know, right? You know I'm gonna keep them up.
So for anybody just hopping on, Nestor did get a bath this morning. He got his nails trimmed. He had a full spa treatment.
I love you. Mr. Best Boy.
And now he just had his chicken breakfast. And we hope to have some results by Tuesday. Some more definitive answers. I know. But he's so much calmer when someone has, when you're touching him.
He likes to be held.
Yes.
And touched.
You feel safe.
If he has some quality time,
Mm-hmm.
I want him to have a quiet home where he can just be, relaxed.
He needs a lap to lie
held
on.
and loved.
Mhm.
That's it. That's it.
He's so easy.
Yeah.
Right, good boy?
See if he wants any more. If not,
No,
he's done.
he's full. It's nap time. He just looks so much better just from yesterday to today.
Amazing.
Really.
Absolutely amazing. I love
Baby.
your chicken on your ear. How'd that get there?
He has an entire huge following, Nestor. Hi, baby. Look who it is. Look who's visiting.
Good morning. Didn't expect that. I forgot he's here for a
Yeah,
bandage
that's
change.
right.
Too interested in him. Yes, you're gonna say right here. You're on the short leash, Ben. You'll be fine.
I come back later and see, okay?
So for anybody hopping on, we have some abnormal values in the blood work, which we kind of expected. We won't have any definitive answers probably until Tuesday. And at that point, we'll have a better idea of how to proceed. But even whatever time he has left, He is out of the shelter. He is, look how comfortable he is. Look at the difference between yesterday to today.
And all his tremors.
All his tremors, yeah, exactly. And he just wants a lap to lie on. So he's very content right now.
Thank you so much, Zoe. All right, guys, I wanted to give you a morning update, and as you can see, Nestor is resting very comfortably. We're doing everything in our power. Whatever he needs, he will receive. The rest is in God's hands. As far as what the results come back, we will know. Please know that as soon as we have an answer, we will update all of you. I'm asking, please don't send a million messages. I know you're dying like we are to know answers and results, but we can't make anything happen any faster. So it just takes away time from us doing other things that we need to do with the rescue. So, and we don't like to ignore anybody that sends us any questions. So as I stated, it's about 2 business days where we will get back all of his blood work. Again, there are a lot of questions in his current blood work results where I don't even want to put the word C, cancer, out there, but that's what they are worried about. So I'm just going to let it be and wait for the doctor's results, for the results to come back. And all we're going to do is just love him and keep him comfortable and give him all the medical and just pray for the best. That's all we can do. That's all we can do. All of his wounds have been cleaned. He got a bath. He's on IV fluids. He's on antibiotics. He's on deworming. I just brought him some nice warm chicken. He ate a good amount for me, so I will continue to do so daily and spend time with him. And just all I can ask for is your prayers right now at this moment. Of course, donations are greatly appreciated for his ongoing medical. This is not cheap. The around-the-clock care is just not cheap. So we don't know. He could be 6. He could be 10 years of age. They don't really know. He is blind. He can hear very, very well. It's crazy the way he looks at you, almost as though he looks right deep through into your soul. He's a Boxer American mix, in my opinion. He was a stray. He had a microchip. I don't know if they were able to contact anybody, but we saw the urgent plea from that video, and we could not turn away, even with 2 full rescue houses. So we're going to let him rest, but I wanted to update all of you. My team, we are on our way out to another rescue right now. We will update more later today. Please, we have 2 rescue houses full of dogs. I had placed a rescue hold on another dog from Miami-Dade. Prior to Nestor, they told me the dog had an adopter, and sure enough, this morning, your dog is ready for pickup with no place to put the dog. It's a little dog, came in completely matted, so he is being picked up this morning. We will update more about that. If you please, I'm begging all of you, we need local fosters. Please, whether it's a big dog, a small dog, we are so desperate for fosters. We're bursting, and we're exhausted. Red is doing, there's how Red is doing. I just saw Tiffany walk by dropping him off for his bandage change, and he is on his comforter. He did great throughout the night. Last night, his first night at the rescue house, as you can see. He's very happy eating his deer antler. So we have an amazing team. Tiffany just dropped him off. I have Zoe here. This is Amy. We came to visit Nestor and check in on him, and he is fresh and clean, waiting on results. Wounds were cleaned, stitches. He was fed, nice amount of chicken, and Red is very busy with his deer antler. So please continue your prayers, and please make a donation. And I just wanted to say thank you to each and every one of you. We will be back later today. This is Amy with 100 Plus Abandoned Dogs of Everglades, Florida. If you are interested in adopting or fostering, please reach out at 877-506-8100 or 100plus PLUS abandoneddogs@gmail.com. We'll see you later today, guys. Thank you.